Hello and welcome to another 5 Minutes With. My name's Adrian Zacher and I'm joined by my co-host, Dr Phyllis Murphie.
Good morning.
Good morning, good afternoon, good evening.
Good day now.
Yep. And we're delighted to be joined by Jorge or George. And George is going to tell us his journey from undiagnosed to where he is now. Jorge, over to you. Tell us about yourself, sir.
Okay, I started in year 2000 with my first polysomnography, which didn't show major events. 5 years later, the same thing happened, rather borderline at that time. And in 2014, Dr. Perichara, a well-known specialist on sleep disorders and a good friend, he prescribed the use of CPAP. Although CPAP was designed basically for obstructive apneas, opening airwaves, my case was more in line with central apneas, but it also had this side effect which benefit very much. And I use it since 11 years now on a daily basis, with exceptions of overnight flights or 1 or 2 days away from home, right?
Okay.
But it's been very successful. I use nasal mask. Initial setting was 14 centimeters of water, and I lowered it down step by step until 8, which showed a mild increase in AHI, and now it's set at 9 centimeters. I don't use ramp, don't use humidifier either, and it works fine. It works with no problem at all.
I can see Phyllis is about to dive in with a question, but what symptoms, may I ask, did you have to have these number of PSGs? What symptoms were you trying to address? I mean, what was going on? If you don't mind, if it's entirely up to you what you share here.
Basically, the typical apnea symptoms, withholding breath and feeling lousy the next day, and quality of sleep very low. It's the obvious facts that happens with any apnea, right?
Right.
And this was worrying not only because the current perceived side effects, but the potential side effects in the long run. Right? So those were the real danger.
Well, you got it. You understood. Phyllis, I'll shut up.
It was just a quick. It's interesting, George, that you mentioned that there was more central events than obstructive events, because a lot of people don't realise that there is a higher prevalence of central sleep apnea that has been reported in some recent studies as well. And so I think that's an important point that you make.
Could we define that? Phyllis, you're the person, you're the expert. For those that are watching that don't appreciate the difference, what's central, what's obstructive?
Yeah. Well, obstructive is when the airway actually closes here and you've got physical closure of the actual upper airway, whereas in central events you get some mild narrowing, but there's a cessation of breathing there as well. So it's coming from the brain as opposed to the back of the throat. So essentially that's the quick description of it. But it's an interesting...
The drive to breathe, isn't there?
Yeah, that's right, yeah. But that was... interesting to hear that was picked up on your study then, George.
Yeah, yes, it was a major change, I would say, before and after the experience with CPAP. And nowadays I find a lot of my friends that have the need using the CPAP, some with trouble. As you know, the rejection figures are very, very high with CPAP.
Yeah. It's hard.
Yeah, they've been reduced when the EPR was achieved. The reduction in the pressure relief expiring. But I think it's a huge market. Well, I understand, reading some of your brochures, that in the UK, 1 out of 4 is assumed to be having apnea-related issues, and of which 80% has been undiagnosed.
That's
correct.
correct.
So that makes, if you say one thinks UK 70 million, that's 17 million potential candidates, right? So the market should be there. And if you, expand this worldwide, it's incredible.
Yeah. So, Jorge, George. So right now, let's put a positive on it. So you've gone through all these PhDs, you've got on with, and you managed to adapt to wearing CPAP and living with it. How do you feel?
Well, since before, much better, obviously. And the next step I'm trying to develop, I've discussed this with Dr. Phyllis Murphie. I would like to have a correlation with O2 SAT parallel to this. I yet don't know which is the practical system I should be in. Maybe finger type O2 detector or any other alternative. The most difficult issue, I think it is correlating, joining the files of the O2 SAT with apnea events. So how can you correlate? I check on a monthly basis, 6-month moving average of my data, and I would like to have O2 there too. But I don't yet have reached, I'll get to that sooner, but it will take some time.
That would be product consolidation, and it'd be a really good idea if there was that sort of feedback loop between monitoring and treatment within the individual.
There are actually devices now that can Bluetooth the actual oxygen and the oximetry to the actual CPAP device. Ooh. And you can get integrated data now as well. So there's a lot of innovation that's happening within that space. I think some of them are a bit expensive right now, but hopefully we'll have more that are more cost effective. There's definitely some there that you can Bluetooth to your device.
All right, I think this is really fascinating, but I think it's also the time to wrap it up. George, Jorge, however we pronounce it, thank you so much for coming along and sharing your positive, happy outcome story. And anyone else that's just had any symptoms, can't get to sleep, keep falling asleep, something happens that you don't like when you go to sleep, take the awake check and go and see your GP. Take the appropriate action that's guided at the end. Thank you very much.
Thank you very much.
Take care. Bye-bye now.
Bye-bye.